Fighting for home health care, it's been an expensive and uphill battle.
So tough for many families. So tonight, the fight to get billions of dollars to help millions of Americans who want to come home in the face of health issues. Well, the fight is on. 5 years ago, he was healthy and happy, a new dad. Then something happened.
Then my left hand started getting weak, and I thought it was just from holding our baby so much. But after a series of doctor visits, I was told I have ALS.
Ady Barkan from California speaks through a computer using his eyes. He breathes with a machine.
It really is horrible. I wouldn't wish this disease on anyone.
But he's home with his wife and 2 young kids. He tells Fox 2 that's everything.
But we can only afford this care because I successfully forced my insurance company to pay for it, and have some wealthy friends who pick up the rest. Without this care, I would probably need to be in a nursing home. And, to be honest, I don't know if that would be a quality of life that I would be willing to tolerate.
So now he's advocating for affordable home care. Congresswoman Dingell introducing the Better Care, Better Jobs Act in the House, which would strengthen and expand access to Medicaid home and community-based services. It would also support stronger benefits for the direct care workforce. Dingell says over 10 years, the cost would be about $400 billion.
People don't understand the tremendous strain that puts on people, how they need a helping hand just in the caregiving. People need help with bathing or food or just simple things. And Ady is an example of how people can stay in their home settings, be very contributing members of the community, but they need some support. And that's what this bill would do.
The president is proposing a jobs bill and a care bill. Those bills are moving forward.
We'll be considering those in committees and marking those up, and are likely to be consolidated into one bill at some point down the road where people will start to hear the word reconciliation.
How far away are we from that, you think?
You know, Roop, I'm not making bets. I'm somebody who's prepared to work all through August on this.
It's a hefty price tag at $400 billion, but talk to Ady and he'll tell you why it's critical.
Home care is literally keeping me alive.
He's hopeful the bill passes to help those who are scared they'll be taken away for no fault of their own. All they want is to stay home.
Almost 1 million children, adults, and seniors with disabilities sit on waiting lists for home care. And too many disabled people have already been ripped away from home and forced to live in unsafe institutions.
Ady's a really a spectacular guy. You know, he has 2 kids and a wife, and he's doing his thing, but he's able to continue to be happy and productive because he feels like he's home. A little perspective for you, Taryn. $8,000 a month for a semi-private room. That's the average for a nursing home cost right now. That's a lot of money, and most families aren't able to afford that. That's where this money would come in to help.
And when you need specialized care like that, you need a certain sort of staff and people who know what they're doing.
That's
we
right.
know a lot of home health care places had to close because of some of the changes with the catastrophic care fund through the auto insurance. So, I mean, there's so many layers to this, and people, the problem is they need that help.
They need that help. All of that other stuff you talk about with the catastrophic fund and all of that, it's like that's all like in the headlines. Bottom line, families like Ady's families are like, okay, I get it, but I just want to be able to stay home, and there's a way to get and live a happy, productive life. So hoping for good things.